Well, thank you all for being here. I'm just delighted to be here today. I feel like I've come in from the desert to be among all of you who are interested in the same things that I'm interested in. It's really a rarity for me to be in such a room with such exciting people and to learn so much as well. As Jerry sets up the first slide, I really want to thank Maciej for putting this together and for your organizing committee and for this beautiful building that Pew has provided. It's really, really lovely. So my talk is entitled Improving Environmental Practices in the Doctor's Offices, but I have two disclosures at the beginning. One is to disclose that I stole dramatically from Cecilia Lynn's work. Practice Green Health is just amazing, and they've been a huge role model for the Florida Medical Association and World Medical Association in developing what we try to talk to doctor offices about. And second, that I kind of lied to you about my topic, because what I'm really here to do is to teach you to take your leadership potential and become Green Team leaders or Green Team inspires wherever you work. I know most of you don't work in doctor's offices at the retail level, but you work somewhere in some office. And everything that is here that says My Green Doctor could be My Green Architecture Office or My Green Administrative Office or My Green whatever. So wherever you are in life or find yourself, make a small piece of your life being to work in or stimulate or inspire or lead a green team anywhere you are. Let's see if I can make this work. Nope. So I represent two organizations today, the World Medical Association, which is a loose association of 120 national medical associations from the AMA to Zimbabwe. And in addition, the Florida Medical Association, which is 16,000 physicians in practice in Florida. Just a little bit about myself. I'm a physician in private practice, member of the FMA Council on Healthy Floridians, which manages My Green Doctor. I chaired the environment health section for our organization, our local environmental protection agency in Jacksonville, Florida, where I live, and was member of the Florida Energy Commission, and I chaired the Florida Legislature's Climate Change Advisory Group 1 year. And my hats off to Cecilia for talking about climate change, because that is the big elephant in the room that we're not talking about. And fundamentally, so many of us are engaged in these issues because of the climate change specter for our children. My Green Doctor's vision is that population health outcomes can improve by helping doctor offices adopt wise environmental practices and teaching these practices to our patients, to our families, and to our staffs. Fundamentally, that's what we want to do. Our hospitals understand this. The resources for greening of hospitals are abundant and wonderful. Practice Green Health, their Green Guide to Healthcare, Healthcare Without Harm, the U.S. Green Building Council with the whole LEADS program, Hospitals for Healthy Environment, Kaiser's Center for Total Health, and the work of the Institute for Healthcare Improvement that Cecilia referred to. And there's so many wonderful hospital initiatives, LEED buildings, energy and water use initiatives, recycling, composting, pharmaceutical waste management programs, cleaning initiatives, greening the OR, mercury elimination, healthy food projects for hospitals, including hospitals with their own farms where their staff work to have examples of healthy growing, community green fairs, medication take-backs, and on and on. And the hospital's really doing a wonderful job, and my hats are off to them for being 20 years ahead of doctor offices in this. So our hospitals, why not our doctor offices? Why not all of our offices in the world? Cecilia Deloche-Lynn talked about the triple bottom line of saving money, impact on people, and environmental impact. And there's so much to gain from going green wherever you work. And I talk to doctors and I ask them, would they like to save money? And they say yes. And then would you like to improve business operations and improve office morale and teamwork, to retain employees and lower absenteeism, improve the public health image of the office, create a healthier work environment, and improve patient and community health? These are goals that are realizable at the hospital level and in the doctor level. So today we're going to talk about four things. Talk a little bit about the natural environment and population health outcomes. And Cecilia talked, but as I talk, think about what Cecilia said, what I said, and be putting these ideas in your mind, because you're going to use this to stimulate others in your workplace to start a green team. These are the fundamental messages you'll communicate that'll say, this is important. This is important, as important as measuring people's blood pressure and documenting their hemoglobin A1Cs. Why address environmental practices in your office? I'm going to talk about the My Green Doctor resource and kind of walk you through it. I'm going to give you step-by-step guides to starting your green team and managing your green team. And then we'll go through one healthy outcomes case study. So I'd like to summarize using the words of recent AMA President Dr. Ardis Hoven, who said the environmental health determines 40% of the health outcomes for populations, compared to just a 10% impact for the traditional work of physicians and nurses in our offices. So if we're only dealing with the hemoglobin A1C and the hypertension, we're missing a much bigger picture of the healthcare puzzle. And so I implore people working in offices and hospitals to think about the bigger picture if we're going to have a bigger impact, and particularly with the new reforms under the Affordable Health Care Act, where it's global health outcomes that we're after. We got to have environmental health in the picture, or we're going to miss it. Just to summarize a bit of the impacts of the environment on health outcomes: air quality, influencing lung cancer, COPD, neurological diseases; water quality, affecting cancer and infectious diseases; waste, including cancer and infections; chemicals, the environment, affecting cancer, arthritis, skin diseases, kidney diseases, neurological diseases. We've talked about foods and their impact on cancer, neurological diseases such as mercury toxicity and the obesity problem. And urban planning is a big environmental issue that hospitals and doctors can influence, affecting lung disease, COPD, obesity, endocrine disease, cardiovascular disease, and psychiatric disorders. And doctors themselves in their offices have specific impacts on the environment. There are millions of doctor offices worldwide. Offices can cause disease. EPA tells us that inside air is usually dirtier than outside air, and I think that's nowhere more true than in medical facilities. Chemicals, particulates, and fungi in our offices. As Cecilia said, we use significant resources: air, water, paper, and many, many chemicals. We're often high cost and highly inefficient. And then there's the issue that nurses and doctors can be role models for our community, that people look to us for guidance about things we do for our health. Why not things we do in our home for the environment? And finally, I think of offices and hospitals as potential sites for education and for environmental change. Think of your workplace as a laboratory for environmental improvement. This is really the same information that Cecilia gave you, putting in the slide form the strong healthcare impact of energy use by our sector. That if you look at the amount of energy used per square foot, we're the #2 user of energy of any industry in America, following only food services. And just always remember that the electricity we use has healthcare healthcare outcomes. This is the example of coal, that when you turn on the light switch, you're burning fossil fuels almost all the time, releasing nitrous oxides, sulfur oxides, and particulates, contributing to heart disease and stroke, pulmonary disease in the form of asthma, COPD, lung cancer, mercury contamination of our oceans and streams, because of course the mercury comes out of the coal that's burned and ends up in the fresh and salt water. 16% of pregnancy age women in America have mercury levels in their blood that are toxic to the brains of their babies. 16%. It's really quite remarkable, affecting 300,000 babies per year. And of course, about 30% of U.S. U.S. CO2 production comes from coal, affecting climate change, extreme weather, flooding, etc. And I recommend that you think about your community. You know your power source. Know where your own electricity comes from, and talk about that in your office. I'm going to talk briefly about Jacksonville, Florida. We're proud of our municipal-owned utility, of a fairly green utility, but has a long way to go. Coal, though, is still 38% of our power source. Natural gas, 61%. Only 1% renewables, and only 0.5% solar. So a long way to go. We're proud that the coal and natural gas we use is the cleanest in the nation, but a long way to go. So when you turn on that switch, you're almost always burning fossil fuels. So Why address environmental practices in your office? I've talked about this, the potential to save money, to create an ethic of resources conservation, and that's probably the hardest to document, but I see it every day in the offices I visit that have green teams. Everyone's thinking about how to save resources. Improve office teamwork and staff morale. I found that people love to attend green team meetings. They just enjoy coming together from different perspectives in the office, whether you're a manager or an administrator or a cleaning person or a nurse or an intake person at the front desk. Everyone loves to come together and contribute ideas, and it really does breed teamwork and improve morale. Create a healthier office, no doubt about it, and the potential to influence patients and affect community health. So I'm going to now turn to this thing called My Green Doctor, but I don't want to tell you I'm selling something, because I'm not. You can use any resource you find to help you bring tools into your office. I think this is one, but there are many, many good ones now out there. So I'm going to talk about My Green Doctor, and I want you to become very familiar with this, or become familiar with another tool if you want, but go ahead and use a tool, and implement it, take it to your office, and make some change. This is a practice management tool for doctor offices, any kind of doctor office, an MD, a chiropractor, a psychiatrist, an outpatient imaging center, an herbalist, really any outpatient medical facility, and honestly any retail office at all for that matter. It's a free website, mygreendoctor.org. It's managed by physicians of the World Medical Association and the Florida Medical Association. It's evidence-based and science-based, non-political. We tell doctors we're not from Greenpeace or Sierra Club, because they would be totally disinterested if we told our largely conservative Republican doctor audience that we're bringing the materials from Greenpeace. But we steal a lot from Greenpeace, and we peer review it and science-base it, and try to bring it to them from their organized medical society to give legitimacy and credence. This is the most complete website for medical offices. We design it with no science background needed. Physicians are too busy to do this. It's usually some excited person in the staff that says we can do this and ends up leading the green team. And it's available to physicians and office staff. So at My Green Doctor, we help you to create and manage an office green team, to evaluate and monitor your environmental practices, to choose from more than 120, actually more than 140 action steps that the office green team can choose from to adopt for that office. And we help an office to qualify for Green Doctor Office recognition. We actually don't really call it certification, because that's not really fair. We don't have people who can go out and can certify an office. But it's kind of LEEDS light. LEEDS is something that's so wonderful but so complex, an office just doesn't have time for that. So we offer a way to get engaged in this, and if you are certified by My Green Doctor, you're on your way towards the LEEDS certification process. So what I'm going to do is tell you about what's in the website, and then I'm going to show it to you, so you'll really have it beat into your brains today. What you're going to find is a registration form, a program summary, something called Quick Start Now, where you can quickly start your green team in 15 minutes and be on your way. Lots of facts, lots of ideas, lots of action steps. We're going to give you a free waiting room certificate just for signing up, just for taking the Green Doctor Office Pledge. So you put that in your waiting room and say, hey, we're doing this. We're working towards this certification. And lots of free education materials, posters and brochures that people can download, print in their office, and give to your patients and staff. We're going to find 7 workbooks with more than 140 action steps and education steps on all the topics you'd hope to see: energy efficiency, renewable energy, water efficiency, solid waste and recycling, drug disposal and chemicals, transportation and commuting, healthy foods, and of course climate change. Also lots of other stuff about how it works and tips for building the green team, the role of the doctor in community health, why we're important, blogs highlighting specific topics, criteria for Green Doctor Office recognition, web resources, references, and confidentiality and responsibility statements. So now we're going to go inside and see what the website looks like. So this is our home page, and at the top you can register now. You can pull down Quick Start Now and get a quick guide for starting up About is some of the details about how the whole thing works. The workbooks, which we'll look at in a minute, other web resources, blogs, and how to contact us. So if you hit the registration button, you get to our simple registration page. We don't ask for much information, no passwords needed, and we don't disclose anything to anybody. We ask people to take the I Pledge to Go Green button, and if you do, you get a certificate right away that you can download and put on your wall just saying, we're on our way, we're going to get this done. We'll go back to the home page, and we're going to look at the Quick Start Now button. And there we help doctors to get started right away. How to register, how to schedule the first meeting, how to plan for the first meeting. Remember, a lot of people doing this have never run a meeting. And so this is a new kind of thing for some of the younger, less experienced people in the office. We emphasize one of the points that came out in the questions here. How do you get the organization to buy into this process? And we really recommend that whoever starts the Green Team talk to your manager or talk to your owner of your clinic and persuade them that this is worth doing. Management buy-in is very, very important for this. We also have a button there called the Green Team Notes form. It makes it very easy to keep notes at each meeting. We encourage every meeting to print out this form or go online and fill it out. Keep notes of the meeting. At the end of several meetings, you have the information you need to send in your request for certification from the Florida Medical Association. And at the notes team, you keep track of who attended, what were the action steps that you've been working on, and what are you going to be working on in the future. And we'd really like to get more quantitative than this. Cecilia is exactly right. As quantitative you can get, you know, how much are you recycling, or how much energy have you saved in the past month, or how much water have you saved. But my experience has been doctors' offices so busy, just get them to show up is about all we can do. So we took out some of that because it became an impediment. We sort of buried it further in the program. So if people want to do the quantitative assessment, they can. I wish they would. But just getting people to come together over lunch once a month is really tough. People are so busy. And we'll go back to the home page. And I want to look at some of the workbooks. So if you hit the workbook buttons, down pop the workbook topics, all 7 workbooks. I'm going to spend some time looking at energy efficiency. So in each workbook, there's an introduction for novices to talk about why the topic is important, whether it's renewable energy or healthy foods or energy efficiency. And after the introduction, there are the action steps. That's followed by some pithy facts. We have a fact list, just if you want to have some take-home messages for each of your meetings. So let's look at one of the workbooks. This is a list of topics just under energy efficiency. We have how to do an energy audit, which we encourage offices to do, although only one office has done that so far. How to do a greenhouse gas calculation, which you can do for the whole office or for individuals in the office. We talk about office lighting, office equipment, heating and air conditioning, windows and insulation, and hot water use. So we have many, many, many topics, little pithy action steps that a Green Team can embrace for their office. So let's just look under one of them. We're going to look at office lighting for a minute. Lots and lots of areas of interest: turning off lights, changing compact fluorescents to compact fluorescents and LEDs, proper discarding of fluorescent bulbs, going to the more efficient T85 fixtures, task lighting, using motion detectors to detect when someone's in the room and turn off the lights when the person leaves, hiring an energy consultant, teaching your staff, teaching your patients, and free office brochures. So lots of elements under the topic of lighting. And these are some examples of action steps. This is under the top of Quick Start Now, the energy efficiency action steps. So turning off machines, adopt a policy. So we ask the Green Team to recommend to the office to adopt a policy to turn off lights, computers, monitors, fax machines, copiers, printers at night. This saves a lot of energy and money. Set computer monitors to sleep mode if they must stay on. Many offices don't let you turn machines off because the IT people are going to be coming around revising software or doing other things. Plug all machines to a power strip to make sure it's easy to turn them off at night. put message reminders on machines, please turn me off, speak with your janitorial staff who may leave lights on at night. So all the little aspects of turning lights off that are hard to kind of figure out right away, we try to provide. Same thing for reviewing energy bill, choosing compact fluorescent bulbs, thermostat policies, turning off your hot water heater. So we try to make these very simple, straightforward, easy for anyone to use, whether we're busy or unsophisticated, whatever we bring to the table. Another one of the workbooks is our Healthy Foods project, to try to encourage healthy foods that are brought to the office, or healthy food teaching of our patients. We actually have a food vendor policy. We recommend offices adopt a sheet you can give to the people bringing free meals into your office, trying to get you to buy expensive products. Why not bring healthy foods that are healthy for your staff and healthy for the environment? So we recommend people adopt this policy, and then lots of other action steps. We have a whole bunch of brochures that are free to download, that office can download and print out. We find these are very popular. We put out 100 brochures in an office and they're gone in 2 or 3 days. It's just kind of odd. I'm in a gastroenterology office, but when we put a topic like energy efficiency, people just eat them up. Your question?
Are those brochures able to be uploaded to one's website so that we can be a little freer?
Oh yeah, just steal them and take them. That's what they're for. Yep. And they're PDF, so it's a little hard to, you have to have a PDF editing software to drop your own logo in, but I encourage you to drop your logo and go with it. Modify, make changes, give them back to us. If you have your own brochure, send it to us. We'll steal it and give you credit for it. But healthy, using appliances wisely at home, safe biking. You know, we're trying to encourage safe transportation, but also to encourage biking for the anti-obesity benefits. We're very opposed to bottled water, so we talk about that a lot. You support your local municipal water system is our message. Energy use, safe and proper gardening techniques, summer safety, organic foods, lots of different topics. And we're hoping to build more of those. Green Team, step by step. Register at My Green Doctor. It's safe, it's free, no passwords required. Take the My Green Doctor pledge, put it on in your lunchroom and in your waiting room, to say already to the public, hey, we're doing something for you and your community. Read Quick Start Now. Make this a management priority. I found this works best when management imposes it from the top down, honestly. That's when it really works fastest, when management expects to have a report every month on where our Green Team is going and how much we've saved. But it works from the bottom up too. It just takes a lot longer. So probably works best if someone says, I want to do this, and then persuades management to make this a requirement. I think that's why hospitals have such a big lead on doctor offices, because hospitals can do that. Everybody works for them. Appoint an office Green Team leader, or find someone to step forward and volunteer. Recruit a few Green Team members who would like to come and listen and participate, and then schedule the first meeting, maybe order the first pizza, make it vegetarian. At the first meeting, again, everyone should agree on a Green Team leader. Read together Quick Start Now. It helps people quickly get engaged. Decide someone to record the minutes on the Green Team notes. Decide when it's convenient to meet. These are very obvious things, but to young people who may not have run a meeting before, it's very important. And choose a couple action steps to get started, usually 1 or 2 at the first meeting. Agree to turn off machines or to turn off lights. Someone has to be supervising that to make sure it happens. Installing compact fluorescent bulbs if you don't have them. Adjusting thermostats to what's recommended. Agreeing to recycle in the office, which means someone has to find the bins, someone may have to take them home every week. Use draft mode and double-sided printing on all your printers. Reusing office paper. Simple steps, but that add up and make a big difference. You know, someone asked the question, isn't this too expensive? And one of the things that I say is you're going to save money in some areas that can let you spend money in other areas. So sure, it takes money to hire an electrician to put in motion detectors, but you've saved money on using less paper, saved money on turning off lights, and it can make a big difference. And I'll give you an example of that in a few minutes. At subsequent meetings, go to the About Us tab to learn more about building your Green Team. We actually give step by step what to do every month for 20 months. So we get you well on your way and well past your Green Doctor recognition status. There's a month-by-month guide. At every meeting, review the previous notes, review your progress for each action step, have someone to be the leader for each action step, consider education steps. Terribly important to remember to talk to everyone else in the office and your patients about what you're doing. Choose new action steps to adopt, how to communicate this, have plans to communicate with everyone in the office, and of course schedule your next meeting. Green Doctor Office recognition is really easy, sort of embarrassingly easy compared to LEADS. We only ask that you meet 5 times and you adopt 5 action steps and 5 education steps. Just get going. And because we're trying to create an ethic in the office of doing this, to get going. This is just the first step in what should be a never-ending process. Reporting to us is easy. You just send in your 5 Green Team Notes forms from your first 5 meetings. And this is all reviewed by physicians of the FMA Council for Healthy Floridians, so we have a team of people who review it. Some tips for success: make this a management priority. Management has to buy into this or it isn't going to happen. Appoint a Green Team leader, meet monthly, choose small, steady improvements. People don't have time to do very much more than small, steady improvements. Keep Green Team notes. Try to engage the entire office. So if you have monthly meetings or weekly meetings with your staff, talk for a moment about what the Green Team's done over the past month. We urge Green Teams to have a tip of the day if they have daily office meetings, or a tip of the week. Teach your patients, teach your patients, teach your patients, and aim for Green Team recognition. So I'm going to just do a brief health outcomes example from our most successful Green Team. This was the Escambia County Health Department, and I was so pleased to see the Health Department director here because health directors have been leaders in this process around the country. Escambia County has 5 medical offices in Pensacola, Florida. They reported to us on the results of their first 11 Green Team meetings, and they reported on 11 action steps. In energy efficiency, they had 7 action steps. Water efficiency, 1. Solid waste and recycling, 6 action steps. 1 transportation action step, 6 education steps, and they gained their Green Doctor Office recognition in January 2011. And they did a wonderful job at doing the pre-intervention and post-intervention analysis. What they found is they saved money every month, starting from the very beginning. It had a 5.2% reduction in electricity use every year. It's been 125,000 kilowatts hours of electricity saved per year. 85,000 metric tons of carbon dioxide spared per year, the equivalent of about 4,000 gallons of gasoline. And the bottom line was about $14,000 saved every year that they did this. Came to about $2,000 to $3,000 per office. So we tried to assess what might be the population outcome if you did this across all the doctor offices in Escambia County. So the health department is a county of 300,000 residents. The health department has 5 offices in the county that are about 674 doctor offices. The health department saved 0.125 megawatts of power. Across the whole community, they'd save, just by implementing these changes in doctor offices, about 16.8 megawatts of power. The health department spared what would be used by about 7 homes in that community a year. If all offices did this in the county, it'd do almost 1,000 homes with electricity to be saved. It would be 11,000 tons of CO2 spared per year from the community. Sulfur dioxide, 116 pounds, and nitrous oxides, 32 pounds. So there's a real potential impact just from doctor offices doing this. But beyond that, the bigger impact is talking to your patients about this and talking to your staff members. And I hear over and over again from Green Team members, oh yeah, my children now want us to do this too, or my children brought home ideas because I talked to them about it, and now we're doing this and this at home. It really can make a difference with time. So in summary, doctor offices use significant resources. Offices adopting wise environmental practices do save money, and that's the hook for doctors, honestly, and gain other environmental and organizational benefits. Savings and improvements are measurable. Doctor offices worldwide present the opportunity to reduce emissions and waste, and doctor offices can influence community environmental health and improve health outcomes for our populations. These Green Team success tips are in your packet, so I'll just stop there and thank you very much. Well, we haven't focused on that. I think it's important. Radon's not a huge problem in Florida, which is why we didn't do it, but I think it's a good idea. Cecilia, what do you recommend in your units?
I would be honest and say we haven't done a lot around that either. Our primary audience has been large where hospitals where they're tested on everything inside, outside.
There are good tools for that. You can go to Home Depot, will sell you a packet that you can put in your basement, and then you mail it in and you get an answer. The bigger question is, what do you do about it? Because you live in the house and you're paying your mortgage on it. And there are some tools. Well, one can.
Radon's one of those issues that it's, I think, very important to look at the context of where you're talking about radon. So in the Mid-Atlantic Center, we certainly get calls from families about radon. And as I think many people know, radon's a natural product, so that gets me one of my constant topics that just because it's natural doesn't mean it's good for you. Because radon's natural, and so is arsenic, and so is lead,
Yeah.
and so is X-rays from the sun and ultraviolet light. So, before I get totally distracted, sorry. We do get questions, but it depends on where they live, clearly. In our own region, there's not a lot of granite underlying Florida. In Maryland, Virginia, Pennsylvania, there's more granite as you go west to get to the mountains. Eastern Shore, Maryland, almost no problem. The best way to find out about your own area is go to www.epa.gov/radon. And then they get you to maps that are local.
Right, but the only way to know is testing.
That gets you to your region, but each home is different. And then you're quite right, you do have to test and you do have to remediate. But again, we have to remember, for example, in schools, radon's usually a problem in the basement or the first level if there's no basement. Second, third floors usually aren't a problem. And so what in the decision making that a family or a school has to make is like, what's that area used for, is also an important factor to take into account. But you're quite right, testing for radon is important, it's easy, it's inexpensive, and the remediation, while not inexpensive, amortized over the life of the time you live in the house, gets to be very inexpensive.
I work in the radon division in Pennsylvania in the DEP, and one of the goals, one of the things we would like to see happen is we would like the initial questionnaire when you go into for your complete physical, and it can be tied in with the smoking question, have you tested your home for radon? And we're trying to reach out to the physicians, specifically in Pennsylvania, and see if we can't get that question put on, the initial questionnaire.
Well, I'll come to you and ask you, and I will borrow your stuff and load it on. That'd be great.
How does that go? Because I'm from Pennsylvania, and I was really going to ask ways in which we can begin to teach our patients about this. And, it's very challenging during the course of a visit to really cover a lot of what we'd like to, but I'd love to know how.
Well, I've just kind of started reaching out to the Department of Environmental Protection, and I'm working with the Department of Health, and I've kind of jumped on board with their inter-control meetings, and I've made a few connections there. There's a young lady who works with the Physicians Foundation, but I'm hearing that it's very difficult to put a new field in that. So, if I could see radon in your plans, that would be great.
Well, does the Pennsylvania Medical Society have a policy on radon and recommendations for their members? Because if not, I can help you arrange that. I know they're very busy on fracking this year, and why not radon? Yeah, that's true.
Well, we're just tying up, we're just finishing up, you have to look at the TEMA report. I can't give out any results yet.
Wonderful.
But if you live in And now after they're done fracking, test again. Well,
Interesting.
then you may be able to say, because there was fracking occurring near my home, then you might be able to make some kind of conclusion that the fracking might have caused the displaced geology and increased radon in your home. We get phone calls from folks who say they've been drilling near my home and I tested and my radon is, 30 picocuries. And we say, what was it before you started? They started fracking. And they don't have a,
Hmm.
Questions?
Thank you.
I'm Katie Hepling. I'm with the Alliance of Nurses for Healthy Environments. And I just want to say on our website, environ.org, we have a number of assessment tools that you can use with your clients. And the one on there that I developed, I'm a nurse midwife, so mine is for childbearing and women population, but I think it's applicable to any population. And besides asking the assessment questions and radons in there, a variety of different environmental exposures, it says why we're asking the question, so it provides just a brief synopsis of why it's a health concern, and then provides information on what the client can then do to reduce their exposures, which I found helped in my office when I was seeing patients, because then they wouldn't come to me with like 30 questions about it, answered most of their questions, and they could take it home with them and be like, oh, if I test for radon, this is what I need to do, for
Neat.
example. And thank you for that. This is a really great resource.
Thank you.
Can you tell us a little bit more about your own personal experience and then the feedback that you've gotten from others in terms of patient reaction when you as the gastroenterologist all of a sudden start talking about climate change, or from other physicians when they're talking about water conservation or things like that?
I think it's very easy to put a little bit of environmental health into every visit. I did a blog on this a couple weeks ago. Just to ask, everyone's changing a medication on every visit. How are you going to discard those bottles of the old medicine? In the garbage can, not in my water supply. Thank you very much. Or just a moment about getting out and exercising a little bit every day. So I just put a little bit in there. No one's gotten mad at me about it yet. But I think that patients like their nurses and physicians to be thinking broadly about their lives and their healths. I mean, I'm a super specialist as a gastroenterologist, but people like us to be thinking about their bigger picture. That's just my sense. It's more difficult to get the office itself engaged because they're so busy. It's hard. Please. Oh, yeah.
Those patients are in those apartments forever. They don't open the window, they don't do anything. I'm almost choking when I hear that. Just a little something what you said, how you discard your old medicine. That might be something like to say that they can do.
Yeah.
So I'm just looking for ways. I tell them to move all the time, but then when I come back, they haven't moved, and the home health aide will say, "Oh, she didn't go for a walk." So
Yeah.
there's nothing you can do about that. But I guess maybe just some other little things that you can tell them to do that they don't feel that you're intruding on them. So I like the idea about how you discard your medicine.
You could go to a number of these websites and create a one-page page for your colleagues who are going to homes and say, environmental tips. And give them 10 things. They can just do one at each home, each visit. It's so easy. And you make a broad impact over time. It's the little steps we take that make a big impact. Be a great idea. If you develop that sheet, send it to me and we'll steal it. and leave your name on it. Yeah. Yeah. Jerry?
One other question, and that's your advice regarding CFLs, compact fluorescents. 10 years ago, if one wanted an energy-saving bulb, those were virtually the only options, but they obviously come with the side effect, if you will, of they do
Mercury.
mercury, and if they aren't handled
Yeah, absolutely. Just in the last 2 years, the availability of LEDs has exploded and the prices come down dramatically. Yeah, if you're buying new, it should be LED. If you can put LED in your sockets, use LED. Absolutely. Yeah, they're just great bulbs.
I was just gonna, I think you started to say it, but I think it's, I'm always amazed by how many of these education sessions I do that overlook the really obvious piece about, if you break a CFL in a home, you're distributing mercury. Don't vacuum it, don't take your broom and sweep it all over the place, like, I mean, there's a dozen brochures out there on
Yeah.
the internet that'll help you figure out how to clean that up, but I think that whole piece, there is a little label, but how many of you take the light bulb out of the container and throw the container away immediately? There is a little label that's on the actual bulb, but how many people pay attention to the label that's on the bulb? So I would agree with Dr. Stack 100% that I think LED is the wave of the future. The lifespan of LEDs is so far beyond CFLs that you may invest a little bit more on the front end, but the maintenance you'll have to do is removed. But especially for those of you who are impacting sort of direct patient care populations, even just making sure that they understand that piece about breaking the bulb in a room, and don't use your vacuum cleaner, and there's so many. We have like a mercury thermometers in your family's health brochure that's from like, I don't know, 1998 or something, that I think is just still perfectly accurate about mercury cleaning.
I mean, we have a mercury cleanup tool in our site, but the biggest intention of that tool is to persuade people to be frightened of mercury-containing bulbs and to go to LED. It's supposed to scare them to LEDs.
Yeah.
Yeah. Thank you again. Appreciate it.